Health news tonight, the New England Journal of Medicine released a study casting doubt on the widely held belief that a daily dose of aspirin can help prevent heart attacks.
What's more, the study claims a daily dose may cause serious side effects. KREM2's Rosemarie Beltz checked in with a heart surgeon to find out what he would recommend to his patients.
Millions of people take small doses of aspirin, like baby aspirin, every day to reduce their risk of having a heart attack or stroke. There is good evidence that taking aspirin can help people with known cardiovascular problems, but doctors were unclear if healthier people benefited. Researchers studied over 19,000 people 65 years old and older in the United States and Australia. The results were recently published in 3 papers in the New England Journal of Medicine. There is still strong evidence that a daily baby aspirin can reduce the risk that many people who have already suffered a heart attack or stroke will suffer another attack. And there is some evidence that daily low-dose aspirin may help people to avoid a heart attack or stroke who are at risk and younger than 70 years old. But for older, healthy people over 70 years old, the risk for serious, potentially life-threatening internal bleeding may outweigh the benefits. These results are raising serious questions in the medical community. However, the last thing doctors want you to do is to stop taking your medication.
The bottom line is aspirin, if it's taken as it's supposed to be taken, is beneficial. Its specific actions or mechanism of action is as an antiplatelet agent. So yes, it will contribute to bleeding because that's how it works. That's what it's supposed to do. And it's also an anti-inflammatory, and it's also an antioxidant, or it can be an antioxidant.
Now, if you're still concerned about your health,
yeah, then it's time to go and sit down with your doctor and reevaluate aspirin and maybe all of the medications and sit down and say, what I'm taking, is this right for me? And review the risk and benefits of what they're taking.
Dr. DeAnda says when it comes to aspirin, it's a matter of getting the maximal absorption of the drug. And the quickest way of getting aspirin into your system is by chewing it. So if you think you're having a heart attack, chew an aspirin and drink it with warm water and then call 911. Rosemarie Beltz, KREM2 News.
Always good advice from Rosemarie Beltz.
Indeed.
Well, still to come.